now we're going to extend it. Yeah, great. So now you're recording. And
All right, we're doing central line insertion. My first step, as the patient is in appropriate Trendelenburg position, is I'm going to sterilize the field. I've got a chlorhexidine swab. I'm going to start in a circular pattern, go from the area of interest out into the entire, sterilizing the entire area that I may use. I'll sterilize both sides of the neck just in case I need to use the other side. With that complete, I'll next take a sterile drape, apply that to the patient. Leave it on. All right. Full body drape is now in position. I can feel my landmarks in the sternal notch, clavicle, at the middle of the neck here, and our area of interest in the middle. Okay, while that's drying, I'm going to turn my attention to the kit, which is a triple lumen catheter central line insertion kit. I'm going to make sure I have all of the everything that I need, and it is in place. So I've got my catheter, which I'm going to flush all the ports, making sure I get the air out of all the ports. Start with the white port, proximal, brown port, and the distal port. Okay. I've got my insertion needle or finder needle here. I'm going to place this on the syringe such that the bevel is in line with the numbers and the bevel is facing up. I always resheath my needles. It's not an accepted practice. Next, I'm going to draw up some local find the point where I feel the I'll find the, using ultrasound guidance, I'll find the artery in the vein with appropriate positioning of the ultrasound probe. I'm looking for the artery in the vein, which I do not see. Adjusting the gain. I see two structures. On the medial aspect of the patient, I see a pulsating structure which is circular, which I feel is the artery. Lateral to that, I see what I feel is the vein. I'm going to press down, and I see that the vein collapses much more than the artery, which continues to pulsate. I'm going to place that in the center of the field, place the vein in the center of the field, and apply some local. Local is being applied in the area where I will be inserting my finder needle. Okay. Next, place my wire in the sterile field next to the patient. I have everything else that I need present here, which includes my triple lumen catheter, my dilator, and my scalpel. And then materials to secure this once once it is placed. All right, next, using ultrasound guidance, I'll again find both the artery and the vein, now focusing on the vein. I'm looking for my needle tip. Which I see a little more, a better field. There we go. So with aspiration, I'm going to watch my needle tip go into the vein. And I'm there. And I've what appears to be venous blood returning. I'm going to advance the wire. I feel very little resistance with the wire going in. Securing the wire the entire time. Again, resheathing my needle, not a common practice. The wire in place, which is secured. I'm going to confirm the wire position with the ultrasound. In both the axial and a longitudinal direction. Wire actually may be outside of the vein. There's wire going in. There it is. I'm going to flip this around. It's a nice view of the wire as it enters the vein, which I just had, and there it is. Okay, feel comfortable that the wire is in the vein. Naturally, we're monitoring for ectopy. Next, I'm going to make a skin nick where the wire enters the skin, trying to go through the dermis to aid in passage of the dilator, which will go on next. Passing the dilator through, I'm going to move it in a circular manner, making sure that I have no resistance in my wire as I pass this. The wire continues to move, and I don't need to go in too far, I just need to make sure that I am into the vein. So that's all the further I will go. Again, always controlling the wire. I'll remove that. Bring my triple lumen catheter onto the field. Control the wire. Next, pass the triple lumen catheter in. This is a right IJ. I'll pass it to about 15 centimeters. Remove the wire. field. We'll next draw and flush on each of the ports of the triple lumen catheter. I may just be drawing back air, which means I'm probably outside of the vein. Probably outside of the vein. All right, lastly, with a Prolene suture, I would next place a device to secure the triple lumen catheter in place, again at 15 centimeters. Then using a Prolene suture, I will suture the catheter in place